Good morning and welcome to this lesson of organs of speech. Did you ever think as to how we speak? In fact, human speech is the result of highly complicated series of events. A number of systems are involved in the production of speech. First of all, it is psychological because it is in the brain that we conceive the idea to say something, and this stage is called as psychological. Through the nervous system, the brain transmits this message to the organs of speech, which make certain movements and produce certain patterns of sounds. Because there is an involvement of the speech organs, which are mostly situated in the human mouth, this stage is called as physiological or articulatory. The movement of the organs accordingly creates disturbances in the air in the form of sound waves, and this stage is called as physical or acoustic. The listener carefully listens to these sound waves and his or her ear catches the waves, and this can be called as the auditory stage. These sound waves are transmitted to the brain through the nervous system for cognition by decoding the sounds, and this is again psychological. So this physical, psychological, physiological, and again psychological are involved in the human speech, which occurs so fast that communication looks very smooth and simple. To understand the simple speech mechanism, the organs of speech is essential to understand the entire process of speech. Let us get started. The speech mechanism essentially has three important systems in the human body. They are the respiratory system, the phonatory system, and the articulatory system. The primary function of the respiratory system is for breathing air and providing oxygen to the body. The primary function of phonatory system is to produce sound, and the primary function of the articulatory system situated in the mouth is for eating and chewing food. These three systems together are called as the speech mechanism, as they provide every necessary support for a proper cognizable speech to be possible. Essentially, these become the organs of speech. The organs that are present within your oral cavity and the nasal cavity. We'll get acquainted to this first. You could see in the picture, the above empty area is called as the nasal cavity. Can you identify? And then separated with the hard palate, you could find the oral cavity. Accordingly, on the left side, you could find the nose from which we take the air, and then the lips, which is the opening of the mouth. The upper lip, lower lip. Just beneath the upper lip, you could find the upper teeth. You can find all these organs within your mouth as well. Understand them in the picture and also correlate them with your own nose and oral organs. So beneath the upper teeth, you could find a hard bony structure called the hard palate, which is separating the nasal cavity from the oral cavity. The hard palate ends with a soft structure, which is called as a soft palate, which you could find when you open your mouth wide and sit in front of a mirror, something hanging from the back. That is what exactly is a soft palate. The tip of the soft palate is called as uvula. Noticed it in the diagram? Very good. And then coming down to the lower jaw, you could find the lower lip, the lower teeth, and the dance master, which is what is called as the tongue. The tongue has got the tip of the tongue, the blade of the tongue, the front of the tongue, and the back of the tongue. Every part of the tongue is very, very important for producing the speech sounds effectively and correctly. This oral and nasal cavities open in a small space which is called as pharynx. Can you notice it in the diagram? Pharynx, Pharynx, pharynx. Okay. Now this pharynx has got two openings. One is what is called as glottis, which is closed with an epiglottis, and the other is the esophagus. The glottis goes into your respiratory tract, and the esophagus goes into your digestive tract. Now this gets opened into trachea with the vocal folds. Can you understand this? We'll have a better understanding in the future slides. These are the organs of speech, the organs that are present in your nasal and oral cavities. Be acquainted with the titles of each organ: the lip, teeth, hard palate, soft palate, lower lip, lower teeth, tongue, and the vocal cords. The very first system that is involved with the speech is called as the respiratory system. It comprises of the lungs, the bronchial tubes, and the windpipe or trachea. The energy to produce the speech is provided by this system. The atmospheric air is taken inside the body through the nose in the breathing process, and the air is drawn deep into the lungs where exchange of gases take place. That is, the oxygen is taken into the body and carbon dioxide is given out. And this carbon dioxide filled air passes through the same path as exhaled out into the atmosphere through the nose. The process of taking the air into your body is called inhalation, and the process of giving out the air is called as exhalation. One inhalation and exhalation together is called as the airstream mechanism. There could be three main types of airstream mechanisms used in human speech. Each mechanism has a different initiator. All three mechanisms may be used to pull air in from atmosphere into the body and is called as ingressive airstream mechanism. And push out the air from the body is called aggressive airstream mechanism. Taking in is called ingressive, giving out is called aggressive. Languages might use any one of them for speaking the sounds of it. It is called as pulmonic airstream mechanism with lungs and respiratory muscles as the initiators. It is called as the glottalic airstream mechanism if the larynx itself with the glottis firmly closed is the initiator. It is called as the velaric airstream mechanism with the soft palate named as the velum becomes the initiator. Each could be in turn ingressive and aggressive. The pulmonic airstream mechanism is used for all the production of English speech sounds and for the sounds of most of the Indian languages excepting Sindhi. Ingressive glottalic airstream mechanism is used for some sounds in Sindhi. Certain African languages like Zulu use the ingressive velaric airstream mechanism. But for English, it is always pulmonic, initiating from the lungs, and aggressive, the air coming out from the lungs. Airstream mechanism that is used. The next system is called as the phonatory system. The lungs are filled with fine capillaries inside, which are called as the bronchioles, which unite to form the bronchus, each from each lung, together which are called as bronchi. The two bronchi unite to form the windpipe or thorax, which is protected by the semicircular bones that can be felt by fingers when moved over the throat. The top of the thorax is called as the larynx. It is a box-like structure with a pair of vocal cords, which are the two-fold ligament and elastic tissue. The vocal cords are attached in the anterior and free in the posterior. By anterior, we mean the front part of the body, and posterior, we mean by the back part of the body. So that their movement causes an opening which is called as glottis. The glottis is used for the passage of air while breathing. The glottis is closed by a lip-like structure which is called as the epiglottis. Of the various positions that the glottis can assume, the following four stages of glottis are essential for the appreciation of the speech. Number one is open glottis, which is voiceless state, and this is what happens when you are breathing. Number two is called glottis in vibration, which produces the voiced sounds. Number three is narrowed glottis, which is used when you are whispering or telling a secret in the ear of somebody. And number four is completely closed glottis. This is what happens when you are eating or drinking. The open glottis The vocal cords are drawn wide apart and the glottis is widely open so that the air stream can pass through the vocal cords very freely. This is the state of the glottis for normal breathing. The sounds that are produced in this stage are called as voiceless sounds. The glottis in vibration is the vocal cords are loosely held apart so that the air stream passing through it causes the vocal cords into motion. The vocal cords are alternately brought into contact and blown apart by the force of the pulmonic airstream flowing through the glottis. Thus, the vocal cords are open and close regularly many times a second, thereby producing voice. This action of opening and closing of the vocal cords is more for a woman, 200 to 250 times a second, than for a man, 100 to 150 times a second. And so a woman's voice is with a higher pitch or with a shrill. The sounds that are produced in this stage are called as voiced sounds. The distinction between voiceless and voiced sounds is important in the description of each human sound produced. The third stage is called as a narrowed glottis. The glottis may be narrowed, bringing the vocal cords very close to each other, but not so much to set them in vibration. The air stream is impelled when it passes through the glottis, thereby producing a soft, hissing noise called whisper. The closed glottis is the fourth stage, where the glottis might be completely closed with the firm contact of both the vocal cords so that the air stream is prevented to pass through. The glottis momentarily assumes this position for coughs, hiccups, while eating, drinking, and for producing the glottal stop sounds. The phonatory system gives the voice to the speech sounds produced. The third system is called as the articulatory system. The organs of speech present in the oral cavity constitute the articulatory system because the articulation of these organs result in the production of speech sounds corresponding to speech. The oral cavity can be conveniently divided into the organs of speech in the upper jaw and the organs present in the lower jaw. As the upper jaw is fixed, these organs are called as passive articulators, while the lower jaw is movable and so the organs of the lower jaw are called active articulators. The active articulators move and make a contact or come close with the passive articulators for the production of various sounds. Let us look at the passive articulators first. The organs that belonging to the upper jaw like the upper lip, the upper teeth, the teeth ridge, the hard palate and the soft palate are called as the passive articulators. The upper lip. The lips, both upper and the lower lips, play a very important role in the articulation of certain labial sounds. The rounded or unrounded lips differentiate various vowels in the initial sounds in the words like ask and ought, while the complete closure of the lips result in the production of the initial sounds of the words like pat, bat, pat. You close your lips completely. Bat. You close your lips completely. Upper teeth. Teeth are responsible for the production of the dental sounds like the initial sounds as you could find in this, this, and faro, faro, th, th. The third passive articulators are the teeth ridge. Teeth ridge or the alveolar ridge is the hard portion beyond the teeth from inside. The teeth ridge plays a very important role in the production of alveolar sounds, like the initial sounds as you find in the examples of ten, t, t, ten, den, d, d, den, nest, n, n, nest. What happens? The tip of the tongue touches the teeth ridge. You can feel the teeth ridge if you take your tongue just beneath the upper teeth. The hard portion that is there is what is called as the teeth ridge. The fourth part in the passive articulator is the hard palate. The roof of the mouth, which is a concave bony separation between the oral and the nasal cavity, is called as the hard palate, that you can feel by taking your tongue beyond the teeth ridge. A plate that is separating your nasal cavity and the oral cavity. The palate plays a very important role in the production of palatal sounds, like the initial sound in y, yes, y, or church, ch, ch. Observe what is happening within the oral cavity to your tongue and the passive articulators. Ch, church. And in the initial sound of judge, j, j, judge. Noticed? The hard palate is that, and these sounds are palatal sounds. The last organ that is present in the passive articulator is your soft palate. It is a soft structure which the hard palate tapers into, which could be seen hanging from the roof of the mouth if the mouth is wide open and seen in a mirror. Just do this experiment and see it, your hard palate and your soft palate in a mirror. The soft hanging structure is called as the soft palate. The tip of the soft palate is called as velum, and hence the sounds pronounced with the velum are called as the velar sounds. As in the first sound of the words like gate, g, g, gate, kite, k, k, kite, etc. It plays an important role in pronouncing nasal and oral sounds along with the velar sounds. Now let us start talking about the active articulators. The organ belonging to the lower jaw, like the lower lip, lower teeth, and the tongue, are called as the active articulators. The first is the lower lip. The lower lip, along with the upper lip, is involved in the production of labial and bilabial sounds. Lower teeth. The lower teeth, along with the upper teeth, help in the production of the dental sounds. The third organ in the passive active articulator is the tongue. Tongue is the dance master in the mouth, which moves and takes different shapes and articulates with different passive articulators to produce a wide spectrum of sounds in any language. Both consonants and vowels are pronounced sharply with the correct articulation of the tongue. Though the upper lip and the soft palate are movable slightly, they still are called as passive articulators because of their position in the upper jaw. Though the lower teeth are not movable, still it is called as active articulator because of its position in the lower jaw. The organs of both the articulators articulate to pronounce various sounds in a language. You have different types of sounds like the oral and the nasal sounds. Let us briefly talk about it. The soft palate in the passive articulator plays a wonderfully skilled role in the production of the oral and nasal sounds. When the soft palate is raised, the nasal passage of air is shut off. And so the air coming from the lungs has to pass through the mouth and in the mouth because of the articulation of various activities and active articulators with the passive articulators, they result in the production of oral sounds. The nasal sounds are those when the soft palate is lowered and the nasal passage of air is opened so that the air is coming from the lungs can pass through the nose, accordingly producing the nasal sounds. As you could find in the very first diagram in the slide, they are called as the nasalized sounds. Sometimes it so happens that the soft palate is placed in such a way that the air coming from the lungs can pass through the mouth as well as through the nose. As you could see, the arrows are passing through the mouth and through the nose, thereby producing the nasalized sounds. There are no nasalized sounds in English, but in Hindi, you have the nasalized sounds like ha. When you produce the sound like ha, yeah, eat, you could find that the air is passing through the mouth as well as through the nose. In English, you could find only the oral as well as the nasal sounds. You don't have nasalized sounds in English. With this, we come to the end of the discussion of the organs of speech. Hope you have enjoyed it. This is something very new that is introduced to you. So I would request you to watch the video again and again. Try to understand each part and relate it to the production of speech. If you have any doubts, you could post it in the Google Classroom or in the WhatsApp group. Bye for now, and thanks for watching it.